Hi, you guys. I just want to talk to you real quick about testing questions and application of the NCLEX rules. So when you're taking a test question, remember, they're trying to test you on your nursing judgment because you are a nurse, so that's number one. They're not going to test you on the judgments of a physician or an ACP. So it's solely about what you've learned in your nursing education. It's not real world, so the things you've seen in clinical, really, some of the things may be on there, but this is textbook application. So make sure that that you're using the theories and the practices that you learned in class and in the text. You have an order, so they're not going to try to trip you up with where's your order. The orders can be independent, interdependent, or dependent. Never pass the buck. Never call someone else, other than your charge nurse, to come help you. You definitely want to take care of everything you can. Stay with your patient. Call for someone to come help you. But don't pass the buck to someone else to do an intervention to help this patient. Of course, the client is always first. And number 5, make sure you know your lab data. They will trip you up there. Hemoglobin, hematocrit, platelets, acidosis and alkalosis, metabolic and respiratory. They'll trip you up there. Communicate therapeutically. Of course, you never give someone false hope. Make sure that you avoid closed-ended questions like yes and no answers. Of course, with the false hope, don't say don't worry. Just give the most accurate information that you can. Learn to recognize expected outcomes. So what you want to do is you want to look 2 or 3 steps ahead. So you're having this problem. Let's just say it's a uterine hemorrhage. So you're looking 2 or 3 steps ahead. So you know if she bleeds, she's at risk for infection. So that would be a potentially expected outcome. You do expect her hemoglobin and hematocrit to go down when she has a bleed. So make sure that you're able to look 2 or 3 steps ahead. Be able to answer questions about positioning. This is a big one for students because they don't really love to review them. But just remember, like Trendelenburg for prolapse cord, things of that nature. Remember, whenever somebody vasovagals, you put their legs up to get blood to their head. You just got to think about things that would aid you in trying to get blood wherever it needs to go. So make sure you know your positions about your positioning. Okay, here we go. So number 10, don't delegate. Don't delegate assessment, teaching, or evaluation. That is so important because we know that what? LPNs cannot eat. They cannot evaluate, they cannot assess, and they cannot teach. So that is a sole registered nurse's responsibility or duty. And remember, the registered nurse is the person who what? Starts the IV. Now, here is some meat and potatoes right here. So, establishing priority. So this is your triage information. So when you're trying to say, who are we going to see first? You're going to have to use Maslow. Of course, it's physical first. So physical is going to be any ailments, any problems physically. Then psychosocial and pain. Well, actually, pain does go with physical. Ask yourself, does this make sense? Like, am I seeing the right person? Use ABCs. So, you guys, this part is so important. Assessment versus implementation. So, you're always going to assess before you implement anything. Who do you see first? You're going to see the unstable before you're going to see the stable patient. Always. Because we need to get them into a place where they're stable and they're fixable. But when they're unstable, we can have a dramatic turn of events and we can have a lot of problems. Real versus potential, and I always use the example here of a placenta previa. So bleeding. So say for instance you have a placenta previa and they're both there to be seen. One is having bleeding and the other one is not. So now we're having a very real problem with placenta previa when it's bleeding. Of course you're going to see her before you're going to see a potential. Acute versus chronic. Of course, we're always going to see an acute condition. So let's just talk about chest pain. Somebody has chronic chest pain. So if you have somebody that comes in with chronic chest pain, let's say they're taking meds for this chronic chest pain, and then you have somebody who comes in and they're having acute chest pain. They've not had it before. It's a major chest pain. Then, of course, you're going to see the acute first, and then expected versus unexpected. You guys, if things are going along and you expect an intervention, you expect a condition that you're going to have to provide an intervention, that is much more stable than an unexpected. If you have an unexpected finding, you definitely want to see that one first. So these rules are very, very important for taking NCLEX, and especially 10 and 11 when we're talking about triage and delegation. Okay, thank you.